This is where it all began. This is the home of bone marrow transplant. When you are considering a place to have your child transplanted, what you want to know is how many transplants have they done? What are their survival outcomes like? We have unparalleled survival outcomes for the children who are transplanted here at the Fred Hutch. And that is because we have done more total transplant than anyone has done.
Here at the Fred Hutchinson and at Children's, we've transplanted more than 10,000 patients.
Originally, we undertook bone marrow transplants primarily for patients with leukemia who had exhausted all previous therapy. And in fact, they were under a sentence of death in days or weeks. After a number of struggles, we demonstrated that we could cure some of these otherwise end-stage patients. Of course, the development since then has taken many turns for the better. But on the records now, there are 100,000 patients who had otherwise fatal diseases who are now more than 5 years post-bone marrow transplant and apparently cured. I was amazed by this. 100,000 people. I couldn't believe it.
Cord blood comes from the umbilical cord of an infant that's just been delivered. And really, the beauty of cord blood is that you can collect it without any risk to the donor.
There is some characteristic of cord blood units that make it a little less immunologically active. So if there's a little more mismatch in the cord blood unit compared to the patient, that is tolerated better.
It's readily available. So for those patients who need a transplant and need it yesterday, we can do very quick donor searches. So this is a very viable source for these patients who need a transplant but can't find a donor.
It's been shown in a number of studies now internationally that adolescents treated on pediatric cancer protocols have better outcomes than if they were treated at an adult-type protocol or facility.
The teenagers that are treated by pediatricians have superior disease-free survival with conventional chemotherapy compared to adults treated on adult protocols.
The most likely reason for that is that the treatments are much more aggressive in the pediatric institutions, and that we think the teenagers can tolerate these very aggressive regimens. The pace of therapy in the adult oncologist is less aggressive because most of the patients in an adult oncology office are older and can't tolerate that aggressiveness.
One of the things I really like about the SCCA is that there's really great reasons for doing what we do. There's a lot of evidence-based practice. We don't do things because we've always done them that way. We do things because new research has come out to show us that that's the way to do things better for our kids.
In order to be cutting edge in terms of the clinical care that we deliver, that really does come from bench to bedside. So you need people who are dealing with cutting-edge science, and then either those people or a different group of people having the ability to translate that into clinical research protocols.
There is an amazing interaction between what's happening at the bedside and what's happening in the laboratories here, and the whole process goes both ways with being able to study the problems that the patients are having. It's absolutely unique in that kind of environment for transplantation.
Children are different than an adult to take care of, so I think that's important to have a system set up that everyone is experienced with children and taking care of children.
They try to make it a really cheerful place. The nurses all are there because they want to be there, and they're amazing with the kids. They make our job easy because they advocate so well for their patients.
We don't want the family to feel that they are not supported as they go through this, because it's an experience that I don't think anybody could be prepared for.
If they have medical questions, we're available 24/7 to answer any questions. We don't want anybody up at night worrying.
Transplant's hard. You know, it's a hard thing to go through. And to have kids come back and look fantastic and normal and healthy and be doing normal things that kids should do is really exciting. If my child needed a bone marrow transplant, there isn't anywhere that I can imagine would be better than the SCCA and Children's.
It's gratifying to know that you've done something that has helped somebody else be a productive citizen or grow up to become a productive citizen.
Every one of us, every day, we ask ourselves, if we were sitting in that chair, or if that were our son, what kind of care would we want them to receive? And that's exactly the kind of care that every one of us tries to provide.